Hello, good morning, namaste. This is Narsimha from DLife, a DLife certified metabolic health consultant, and also the academy at DLife Healthcare Private Limited. Welcome to another course review video. Today with us we have Dr. Vipin Dubey, a very popular orthopedic surgeon who is based at Madhya Pradesh. Dr. Vipin Dubey is also somebody who looks into is basically a trauma surgeon and very popular in doing joint replacements also. Welcome, Dr. Vipin, for this course review podcast. Nice to have you today on this Sunday morning.
Thank you. Good morning. I'll call you Raju, sir,
No, Raju is enough.
because you are senior at the helms of the affairs, no? So, like, you are sir to me. All those who are senior in D life are all are like teachers for me. Thank you for calling me. Pleasure.
Welcome, sir. So, you being a doctor, a very popular surgeon, and tell me what made you look into nutrition and why D life?
So, to start with, like, it was like initially it was my own problems to start with. I am a known Hashimoto's plus. Main thing I would say I like obese. So that was it, and I had like 4 spine surgeries in the past, and so because of like initially when you start now you feel like you can reduce your weight by like running around, doing gymming, and all those things. But what happens? You start like running and gymming, you start eating more. So once like your muscle mass also increases, and the other thing is like your weight doesn't go down and start eating more also, no, like when you are not having guilt. So it was like going on for so many years. So like my weight was long back in 1995 was around 90 kgs, which rose up to like 107 1 year back maybe. So when I like then at times I started like doing some other things also, but like my weight was not going down at all, not 1 kg also, I would say not 1 kg. So I came across Mr. Satyajit Das, who himself is a like certified D life coach. So I got to him. So I was doing his like that weekend podcast he used to do, or live lectures he was taking. So initially I started with him. Then I wanted to learn more because I find it very interesting. एक एक तो क्या है ना, कोई उल्टा बोलता है ना तो बहुत जल्दी हिट करता है. Previously it was not like eating protein, and an amount of protein you can eat or fat you can eat. In our this medical side, no, if you want to reduce weight you have to eat less or run more. That's it. It's like calorie thing. So you can do for like some time, you can do sometime you cannot, like the society, kind of society we live in, and that too in like northern part of India is like all, you understand, no, that all thing happens. So Satyajit sir, then I had like interest in nutrition also, and I find it like very interesting. So I approached to him कि मेरे को और सीखना है, कुछ और मेरे को मतलब कुछ और चाहिए. So he guided me. I would say he guided me, introduced it to this community, D Life. So he took he kind of gave me the phone number of Anup sir and people like him. So I contacted and like kind of I joined, and I find it very interesting. I'm glued to it. My wife, who is an anesthetist, she's so happy that after like MBBS I completed in 1995, long back. Post graduation also by 2002, so like more than 20 years in active practice. She was so happy for me. Then maybe for result we'll talk later. What happened after that?
Yes. That's true. So, see, in DLF, we have more than 64 mainstream doctors doing the course.
Yeah.
And no, what you said is absolutely right. Eating less and moving more is not going to give any results. ट्रेलर तो अच्छा रहेगा मगर पूरा पिक्चर तो ज्यादा टिकेगा नहीं. Okay, so there is science
वहीं
behind.
पर आते जहां से चालू करेंगे वहीं पर आ जाएगी, या हो सकता है 1 साल बाद 1 किलो और ऐड हो जाता है पर मंथ के लिए।
Absolutely right, absolutely right. So this is where everybody should understand one important thing. See, weight doesn't increase by itself. Something is definitely wrong in metabolic health. And I keep telling many people, before you start working on your body, you should understand what actually works for your body, and then you start what you're supposed to do. Yes, and nice, sir, nice. Then having completed the course, so what is that which impressed you a lot about this D Life's course?
Content, crisp content. Content is so crisp. No, there's no beating around the bush. Message is clear. There are like single liner, a kind of verdict. आपको कुछ इन्फरेंस नहीं निकालना है लाइंस का. मैसेज इज देयर, यू हैव टू फॉलो. मैं बहुत कुछ उसमें मतलब आई एम लाइक अ मेडिकल ग्रेजुएट, मे बी इट्स इजियर फॉर मी, आई वाज थिंकिंग, बट व्हेन आई वेंट थ्रू द कोर्स the message was clear for everyone, even who were like not like from medical side. That's why it's so popular now, no? And people are getting
Yes,
results out of it, no? If you're reading
yes,
something, applying it to your life, and nothing comes out of it, you won't follow that. So I see like that's why like you're saying 64 doctors, no? It's because of that only. In our practice, we see patients, so many patients, no? But when result doesn't come, no, we also know that patient may not turn up again.
yes,
So that happens with the course also. So people are seeing results. That's more and more people are joining. And this is like word of mouth was publicity, no? This is best.
yes,
If somebody says that he is good or she is good or that thing is good, वो फिर उसमें कुछ है नहीं ना, because the कहने वाला is like either your brother or friend or sister or real people who you have faith on him or her. So like it's like real conversion, no? So like it's the best, no, publicity. Doctors see practice होती है. And that is a solid practice, no? Over a period of time you have like, so I think D Life is going that like very organic way. Very happy for me and D Life as well.
yes, yes, yes. So what is that one? Can you tell a couple of points which impressed you the most in the course? Something which became a silver lining for you.
First thing is the content. Content is the boss.
Content
ऐसे
is king.
या कंटेंट इज किंग. अब पिक्चर जब वही अच्छी होती है जिसकी कहानी अच्छी होती है. तो इस पिक्चर की कहानी बहुत अच्छी है और एंड भी बहुत अच्छा है. बिकॉज एंड की बात एंड से चालू करते हैं तो आई वॉज लाइक 107 एंड व्हेन आई लाइक स्टार्टेड फॉलोइंग दिस low carb, high protein, high fat kind of Anup sir's 100 grams formula, विद इन नाइट मेरे को लगता है 1 महीने में मेरा 3-4 किलो वजन कम होगा विदाउट मच ऑफ एफर्ट. आई वॉज ईटिंग लाइक फुल. आई वॉज ईटिंग फुल. कभी ऐसा नहीं हुआ कि मेरे को और पहले व्हाट आई यूज्ड टू डू इज लाइक इन द नाइट, बिकॉज मैं 12-1 बजे तक सोता हूँ. माई वाइफ लाइक यूजुअली स्लीप्स बाय 10. तो आई एम रीडिंग समथिंग और आई एम वॉचिंग समथिंग. तो रात को एक बार 12 बजे फ्रिज तक घूम कर आता था. बट आफ्टर ईटिंग दिस like satiety, no, after having like this satiation of protein and fat, I hardly मतलब मेरे को लगता है महीनों, मतलब ऐसा होता नहीं, कभी कभार कभी ऐसा हुआ तो हुआ, otherwise not. And it's like carbohydrate cycle, it happens. So from 107 to 4 kgs in 1 month, and like 6-8 months, like I came down to 93 kgs now. I'm 5 feet 11. Yeah. And without
Fantastic,
much of
fantastic.
effort, like if I like follow by book, so probably because my target is like I wish to go down like more on weight. So maybe sometime later, if we meet later, maybe like 84, 82, that's my target start.
हो जाएगा, वो भी हो जाएगा.
वो भी हो जाएगा.
वो भी हो जाएगा.
वो भी हो जाएगा.
That's nice. That's nice. See, D life, 100 gram carb max per day or 20, 20, 60, whatever Anup Singh
Yeah.
has designed. It is so nice that, many people experience this, eat to satiety and, lose fat, lose weight without even actually putting too much of efforts.
Yeah.
This is what we keep telling. When your plate is less than 100 gram carbs per day, aligned with 20 20 60, like whatever Anup sir has designed, that is going to be a nutrient dense meal. And when you nourish your body with a nutrient dense meal, body will automatically start shredding whatever unnecessary burden it was carrying for years.
Yeah. One thing more,
Yes, sir.
like silver lining, one of those like was like family also, like community, people around in D-Life. सबसे अच्छी बात तो है कि it's like it's not like it's north, it's south, like it's like pan India, no? Very
Yes.
cosmopolitan. People like you're talking to somebody in Bihar or maybe in like Tamil Nadu or like in Kerala or Bangalore or Delhi. So there are people all around, like, so they understand. दूसरी बात यह है कि support is so good, no? Like when you are on the group, you post some query, you'll have like n number of like replies to it. And maybe like personally, you are not knowing many people. I like keep on watching people like Dr. Jasmeet Kaur, Shashikant Iyengar, Arun sir probably is like one of the like most pioneer, like senior people. And like they give you perspective, no? Different perspective to one problem. So that is like very heartening to see, because in conventional teaching, you don't like get to like one-to-one interaction, no?
Mm.
Here you are kind of like interacting every day, every minute also. Like if you
Yes,
at like 11 p.m. you put some query, probably till morning you'll get 5-10 answers, no, to it. So it's
definitely,
very
definitely.
supportive. And at the same time, I find it like so interesting and thankful also. You were also like part of it, right? Like somebody is getting injured, somebody is having an orthopedic problem, they call, like put me a message and they call me direct. I feel so happy, and I happen to see many patients daily. But that is for like, you understand, no, commerce.
Yeah.
But that is like friends and families, like your like families extended. I like that.
Yes, yes. That's how Anup sir has created this team. At DLF we are all a family, one family, and nobody is alone in the DLF. DLF has the support of everybody. All of us are a very big family, and all of us are working towards the same cause.
Yeah, that's
Nice. Uh, you were also, since you have done the course, I'm sure you would have accessed the DLF forum also. And you
yeah.
were telling, one question, and there are n number of replies from, various corners coming, which you basically don't get to see in any conventional, educational system. That's great.
Yeah.
So, what do you think is something very, very, very important or very interesting in this DLife forum?
One thing I will tell you, that even in like if you compare medical teaching with this, in a medical teaching, when you go to rounds and you are like your teacher is there, your boss is there, your professor is there for a patient or for a problem. So he'll tell you one thing only, no, one thing, two thing, like perspective from one person only. Here you put like you ask a question, you'll have like 10 professors to tell you. Okay. So like for like one problem, you can have many answers to it. And when you go for a treatment of a person, you need those, because writing medication or writing supplements or telling a patient to behave in certain manner may not work. So it's like, so when patient, like even if you are like a patient comes to you, he wants you like कि आप उनको खाना भी बता दो, आप उनको रहना भी बता दो, आप उनको चलना भी बता दो, और उनको दवाई भी बता दो. तो आपको एक होलिस्टिक अप्रोच चाहिए. So you learn a
Yes.
holistic approach here. Like कोई आपके पास आया तो आप उसको पहले मेरा भी ऐसा नहीं था. Being a doctor, I happened to see so many patients, no? So what used to have like people like with hypertension and obesity, no? Mostly are like patient comes to me for osteoarthritis, knees, mostly. So they are mostly obese, grossly obese, hypertensive, diabetics also. I happen like every other osteoarthritis patient is like diabetic also. Previously was like very hopeless situation because there was like not much to offer other than the surgery, because osteoarthritis is ultimately are going to operate upon those patients, no? Otherwise, like usually they don't like
Mm-hmm.
respond to any other treatment. You can prolong their kind of, I would say, prolong their misery only by giving medication and all, and doesn't work as such. But now I can tell them, if you don't want surgery, how you can kind of reduce your agony, because not every patient is fit for surgery or willing for
Mm.
surgery or may not afford the
Yes.
surgery because it's very expensive. So this probably is like kind of at feathered in my practice also. So there are like things now I can tell. I usually all these patients I call them like for my evening clinics where like comparatively I'm freer when we don't have an operation theater to perform surgeries there. So in evening I call them, and I kind of do a D-Life kind of coaching to them in my existing setup. I like not started doing uh, pure D-Life coaching, but I'm like, this is helping me a lot.
That's nice. That's nice. So you were telling about holistic approach, and when you were telling this holistic approach, I remember, Ira Sahai, the chief operating officer of DLF Healthcare Private Limited, were tweeting some months back, a case where you referred, 16-year-old, I think so, which I think it was some autoimmune condition, and there was a great progress in that
Yeah.
case. Can you please tell a couple of lines about that?
That girl lives in Pune, and it was such a coincidence that she was there with me for 2 days. Yesterday only she left for like Riva, nearby place where like paternal family is there. So she was here. So that girl, she was like having autoimmune skin condition, and it was not responding to treatment. She was she was on Solimetrol, that is like IV steroids, for quite
Hmm.
some time, and on biologics also, rituximab and all those things. No, you know. So they are very costly. One injection costs about like 40-50,000 rupees, and you need like once in a month. She was needing it. In fact, before talking to Ira, she took like 3 injection in 3 months. So you can understand
Hmm.
the kind of like economical financial burden they were having.
Yes.
Plus, the young girl was going through such a trauma. She was like almost like 100 kgs, I suppose, and she had a lot of like acne, pimples, and all because of steroid and all. She become very plump, almost like recluse, like not going out of the house only. So I introduced her to Ira. Mm, Ira took her case. I was thinking initially she may not take her case because it looked like a very complex thing to me, uh, going by allopathy, because skin conditions are like very hard to go into remission as such, if I say so. And she was on such medications. Well, these medication, like as a doctor, like it's kind of last resort medications, no? Solimetrol and all, Dexona. She was routinely on all this. And other than this, she was on Levocetrizine, all those medications I'm not talking about. She was on. So Ira took her case, and she's almost like more than, it was in August, I suppose. Yeah. So since then, she didn't have any eruptions. Almost 6 months. She didn't have any eruptions. She had lost weight also, 5 to 6 kg.
Fantastic.
Yeah, 5 to 6 kg she has lost. And she was, when she was here yesterday, she was following full protocol, LCHF protocol. She was following D-Live. Yeah, she was following D-Live protocol. No, I cannot eat mama. She asked, call me mama. In fact, her mother is my bhanji. I am her mama, but she also called me mama. So बोली mama मैं नहीं खाऊंगी ये सब. She had only eggs, vegetables, on real pure. That's very heartening to see actually.
Yes.
You are living by like some kind of a discipline, no? In your
Yes.
yeah, that's the and that too. Who the girl who is in 11th class, no? And I saw her before also. She ate all these dominoes and all those things till she was like kind of vomited. I must tell you.
Mhm.
And this time I asked her, Ki, you want to go out? I'll take you because the parents were not with me. But she said, no, I'll not take. That was most heartening thing to see. In fact, I called my kids also. They are at Bhopal.
Mm,
At
mm.
Manvi was here and she was following the D-Life protocol so diligently under no one, Ira. So thank you, Ira, also for that. She's so happy. They are very happy. Parents also very happy.
Excellent, excellent. And that would have boosted her confidence a lot. The girl's confidence would have, gone up. She would be facing the world with more, confidence. And as you said, yes, DLF protocol is a discipline for life. And
Yeah.
who else can do this better? It's only Ira Sahai who can, she any complicated case which comes to Ira Sahai, we see within weeks we are seeing huge improvements. And I always tell this: wherever allopathy has failed, Ira Sahai has given fantastic results in all those cases. And if you see Ira Sahai's timeline, she has handled only complicated cases.
Yeah, I saw that. I met her in Mumbai also last August also. So I was so happy to meet her, sharing. Means like you understand, no? The person
Yes,
who like
yes,
yeah, she knows the subject. That's it.
yes, yes. And whether you are 16 years or 70 years, DLF protocol works.
Yeah, it works.
100-gram carb max per day with 20-20-60, it works. It has never failed.
It's simple, no? It's not complex.
Yeah,
It's
it's
not
simple.
saying you don't do this, you follow this at least and see the result. And that happens
Yes,
when you fall in line, no? You fall in line. It's not like
yes,
when people are like following this protocol, no? They're like walking also starts because they see the result, no? The good thing happens to their life. They're this thing, no? Good hormones. They start secreting in
yes,
your mind serotonin, dopamine, all those things. No, when you feel good and your like mental fog is gone, then you start like
yes,
thinking. No, when you start thinking, you won't like think bad about yourself. No, so you
yes,
start thinking good about yourself. Good things in life, everybody knows what are good things in life. So like
yes.
people they don't follow. So like everything lines in falls in line in perspective. So that is like I would call it like for me it's a life changing experience after like doing my medical this thing is like best thing happened in my life.
That's nice. That's nice. And now that you are legally certified, do you think that the course fee you paid was worth everything at the end?
I'll tell you something. Initially was
Yeah,
like
please.
when I like came to know about the course fees तो मैंने कहा यार ये तो बहुत ज्यादा है because my time like MBBS fees was 600 rupees per year 600 rupees per year तो मैंने कहा वो इतना पैसा तो कभी दिया नहीं तो मैंने कहा बहुत ज्यादा है लेकिन now I find it like every penny worth it. So, because you don't have to buy any course material from outside, so much on the forum, recipes are there.
Mm,
It's a kind of
mm.
ready reckoner also, no? Like you put a patient's profile there and you get answers.
Yes,
That is also like customized answers are there, no? For a patient, you
yes,
like you put on forum and you get answers for it. So if you're not getting anything for a patient, you get like support from your members also. Like so many people are working for you so it adds to like whatever like worth you are no so that is very good thing and I really find it like the course is for the content for the accreditation it's worth it more than worth it I would say it's
yes,
very cheap I would say like
yes, yes. And this course has 144 CPDRs and it comes with
yeah
NSDC partner certificate. This NSDC partner certificate can be pulled into your DigiLocker directly.
yeah
And from batch 9 onwards, some exciting things are coming up, where live lectures from international stalwarts will be there, and, even DLF global faculty. And then we'll also be having something called a paid internship coming up from batch 9, where, a large part of the fees can be recovered. And why not? You also get hands-on experience working under senior mentors.
Yeah, that would be great,
So,
I suppose.
yes, all these under one umbrella. You have knowledge, you have skill, you have a platform to, apply your skill. You have a platform to get experience and a platform to, make you empower also. All this one and
Yeah,
only D-Life's low-carb nutrition and metabolic health diploma by D-Life Healthcare Private Limited.
yeah.
And so, last question, sir. And what is that you would like to tell to a prospective enrollee? Somebody who's looking to enroll for the course, what is that you would like to tell them?
Being a doctor, I would like suggest like join D-Life, and you have to like unlearn to learn in D-Life.
Yeah. Yes.
Yeah, because your previous teachings are different, no? So you join D-Life and you learn for your life, no? It's a life-changing event which should happen in everybody's life. I was reading today only that like 45 crores will be overweight like next few years in India. 45 crores, like
Mm.
one third population. So it's like massive burden. So people can join D-Life to enlighten their own lives, their families, friends, and for a professional career also, because these are going to increase only, no? So like it's a good thing to have in your armory.
Yes. 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 Yes.
And I
And
urge
one.
my like doctor community, doctor friends also. I keep on
Mm.
telling them, but you understand, no? Like it's like a big uh, doctors are like bit egoist, no? They think that medical science is like supreme. So need to be open minded and learn.
Yes.
It's a, like
Yes.
it's an experience. Nutrition, to learn nutrition is an experience through day life.
Yes. Yes. So we have almost around 64 doctors also doing our course, as I told you earlier. And I would like to ask you one more question here. See, in our DLF course, after doing the course, you might have learned, oh, this was a myth, which I used to believe this earlier, but now practically, no, that is not right. This is right. So would you like to tell a few things about that?
First thing is the fat. First thing is the fat. Fat was otherwise a big no-no. Like, but now I could like experience myself, no, having anything, protein or maybe carbs also with fat. Like you have so much of satiation, no, satiety is
Yes.
there. So this is one big myth that fats are like that bad. You cannot over consume anything, that we all understand, but fats are not that bad. Protein, the other thing is like if you eat protein you'll end up as a kidney disease, CKD. So that doesn't happen that way, no. And carbohydrates are like all good things are carbs, no, this is not right. I learned it like it's like it came to me naturally now, like reading and like applying on myself. I could understand.
Mm.
And now like people in my family, they all understand, no? Wherever I go, I get what I want. So like everybody is so now understanding now, and they are also like everybody is like keeping new changes to their lives also, seeing the changes in me. I have
Yeah.
two sizes down now. My waist
Oh,
size
nice,
and like
nice,
collar size
nice.
also like decreased. You can understand. Like,
तो डीएफ एक ऐसा कोर्स है जो जो जिंदगी बदल देता है.
yes, it's a life transforming. It's like not life change. It's life transforming, I would say.
Yes.
Right? Life
Yes.
transforms around it, and it's a lifestyle thing. No, you are not. ऐसा नहीं है कि आपको ये बंद करना है, ये नहीं खाना. It's a like lifestyle. It's not like some kind of a diet or fat diet. ऐसा नहीं है. It's like lifestyle. You have to modify your life. And हर आदमी कोई भी होता है अच्छे के लिए कुछ ना कुछ करना पड़ता है उसका. तो ये अपने जीवन के अच्छे के लिए करना चाहिए. आप कोई कोच बनेगा, कोई नहीं बनेगा, लेकिन अपनी लाइफ को चेंज करने के लिए इट्स लाइक गुड
Mm.
फॉर एन इंडिविजुअल ऑल्सो.
Yes.
Even if you don't want
Yes.
to become a coach, you can join D Life as like for your own life. It's an
Yes.
investment. So I think it's a must do course for everyone.
Yes. Yes. Yes, and when it comes to the low carb and metabolic health in a global spectrum at the world level, the face of India is Mr. Anup Singh, who pioneered 100-gram carb max per day with 20-20-60, and has been transforming lives since 2014. Not yesterday or not day before yesterday, since 2014, where there is nothing that has been failed under a D Life LCHF.
Yeah, I could like you can like take a leaf out of his life, no? So like from 2014, he was so highly diabetic, transformed his own life,
Yes,
transformed life of many. People can
yes,
understand, no? Take a because you have a live example of his, no? That
yes.
from 2014 he's living a pill-free life. Otherwise, like diabetes, like you start with diet restriction, starts metformin, then one more, and what happens like is like you are on insulin one day, and it's not a treatment that अभी जो भी पेशेंट आते हैं मैं हमेशा उनको क्या मुश्किल होता है बिकॉज लाइक यूजुअल एलोपैथिक एमडीज नो दे वो एक कटोरी पोहा एक कटोरी ये हर 2 घंटे में बिस्किट 2 घंटे में तो उनको समझाना बड़ा मुश्किल होता है पहले उनको बताता हूँ कि भाई पहले आप समझ लो कि ये ऐसा चलेगा और मैं उनसे उल्टा बोलने वाला हूँ पहले से आई अनाउंस बिकॉज और उसमें कुछ भी है नहीं बिकॉज यू लाइक शुगर इंक्रीज करो फिर उसके बाद एक टैबलेट खा लो शुगर इंक्रीज करो फिर इंसुलिन ले लो व्हाट द फन इन इट मजाक लगता है वो लेकिन आई डोंट नो
Yes, yes. All those type of all those myths have been busted here. You need not eat 6 meals a day is not required. Need not eat every 2 hours. Even I've seen some cases under Ira Sahai ma'am where even without walking a step, fat loss has happened. Eating with full satiety, all under 100 gram. Yes.
Me too. Me too.
Yeah.
Initially, I was not doing any exercise or walking because I thought कि I'll concentrate on this kind of meal pattern only, and I'll not give time to other things of my brain. I'll just follow the kind of like diet which is like D Life is like suggesting, and
Yes.
that was like the result came from there only. इसमें कुछ भी वो नहीं है मतलब there is no ambiguity and which never happened in my life, never ever. And my weight dropped down from like 13 14 kgs like in a jiffy
Mm.
without much of
No.
effort, just like proper eating pattern, nothing else. Eating two
Yes.
times a day,
Yes.
that's it.
Yes. So I'm glad that a lot of transformation has been happening within you and your patients also. All credits to D Life, Anup sir.
Yeah,
Anup sir keeps telling, you can control your sugar even without losing 1 gram of body weight. Losing body weight is not compulsory to, get your sugar under control. That exactly happens with 100-gram carb, max per day, with 20-20-60 formula, whatever Anup sir has designed, particularly for Indian vegetarian. When you talk about the Indian context, there is nobody else who can make LCHF sustainable, effective, and effortless, like how you said.
yeah, I understand
Uh,
fully.
yes, yes, yes.
Even I
So
tried
that all
keto diet
those,
also, no? Keto diet you can do it for like 5 days, 10 days, 15 days, then again it comes from where you
yes,
started, no? So this is kind
yes,
of sustainable model which can like really can work for at least our Indian context, I feel. The way we
yes.
eat and like how our like life goes, no? So that's it. Anup sir is like
Right.
he's supreme.
Yes, and all those who are watching this, podcast, if you want to know more about the course, or if you want to know how DLife consultation works, you can always log into www.dlifehealthcare.com. You can also click on the discovery calls. You can call us. We will give you all details. In English, Hindi, Kannada, Telugu, Tamil, or seniors are there who can talk to you, give you more details about what exactly happens and how it works, and wish one day you also transform your health like how we are watching it now. And thank you, Dr. Vipin Dubey, for coming here, giving
Thank
your
you.
insights. Thank you very much. It was,
Thank you.
very pleasant having you today. Thank you very much and wish you
Thank you
good
for
luck.
calling me. Thank you for calling.
Thank
Thank
you.
you. Thank you, sir. Good day.
Thank you.